my name is Dr. Karen Sheridan, and I'm the owner of Access Autism Testing and Consultation. And I'm here to talk to you about the advantages of getting a telehealth autism evaluation. I know a lot of people might have some trepidation about doing this type of assessment over telehealth, but there are many advantages to it. The first one being that the clinician really needs to see your child, behaving like they would in any given day at their baseline. And I think an advantage of telehealth is that we get to see your child in their natural environment, around people they're comfortable with, in familiar surroundings. And I think as a clinician, it's good for me to just see how they are on the daily through the telehealth process. Number two, I have had clients as a treating clinician before with autism that are very afraid of going to healthcare visits. They get very anxious about going to the doctor, the dentist, really anywhere that looks like a doctor's office. I've actually been on a lot of doctor visits with clients before to help ease their anxiety with this. So with telehealth, this eliminates that. You don't have to worry about having to take them somewhere that's going to provoke more challenging behavior or more anxiety. You also don't have to worry with the travel. This is really great for families in rural areas that don't have, local access to places and providers that provide autism testing. Also increases our reach as a business. We serve Louisiana, Texas, and Florida, all virtually, and we're interested in expanding that territory too. So if you're interested in us coming to your state, let me know. I would say the other thing is, please note there's plenty of evidence-based measures that can be used in the telehealth modality. The Autism Diagnostic Interview Revised, the Child Autism Rating Scales 2, the ASD PEDS test is actually for telehealth to elicit structured tasks that will help me see more symptoms of autism, and it was developed with that purpose in mind during COVID, and is used at Vanderbilt during COVID. So there are plenty of measures that can be used in that modality that will get you the answers that you need for that diagnostic clarification. Obviously, all these tests are just a piece of data. There's lots of different elements to a good assessment, but know that there are plenty of measures that can be done over telehealth. And the last thing is just having access to specialized providers. I am a clinical psychologist. I have worked with the autism population since 2003. I'm a doctorate level behavior analyst, which means I'm licensed and specialized in applied behavior analysis techniques, which is the most empirically supported treatment for autism. There's not a lot of providers that are that specialized, that do autism testing, and that would be as knowledgeable about what you might need treatment-wise after a diagnostic assessment for autism. So because I'm able to have such a reach in 3 different states and serve people that are outside of my area, it helps families who don't have that kind of access to specialized providers gain that access. And that's what we're here for, is to make sure you're not on waiting lists for 1 to 2 years and that you're getting your children into early intervention as soon as possible. So if you are interested in our services, please reach out. 225-285-3956 or look at our website, www.accessautismtesting.com. Thank you.